Columbine, Virginia Tech, Aurora, Colorado movie theater, Sandy Hook Elementary, and that's only a partial list of the deadly shootings that have rocked this nation. Oftentimes, it takes a tragedy before there's action taken, and Sandy Hook has again initiated the gun control debate. But professionals in the mental health field are wondering aloud if this latest shooting will get state and federal officials looking into more funding so people with mental health issues get treated and fewer of them fall through the cracks.
It is unfortunate that is what it would take for mental health to get looked at closer, but it certainly draws the attention of the general public and then forces those empowered to have to respond to the questions about where the funding is and why didn't this person have access to treatment if they needed it.
Tammy is the Chief Operating Officer of Coleman Mental Health Services with offices in Lima, Kenton, and St. Mary's. She addressed the Lima Rotary Club today, saying they employ 120 people, but are still having trouble with finding psychiatrists to come to this area. She says 4 years ago they saw a 25% cut in their funding. That was a $2 million hit. And now the Newtown shooting had their
It is a balance. It comes in ebbs and flows. It's a very unpredictable demand that comes from the community, so it's hard to make sure you're staffed accordingly and that the needs of services are available according to what may happen. We've seen a huge influx in telephone calls and crisis after the shooting because people started to get worried. That young man reminded them of someone they knew and someone in the schools and someone they go to church with, and so the demand came, but it's gone now.
Coleman Mental Health Services treated 4,000 people last year. Cologne says they have a waiting list but are managing the best they can with the budget that they have.